As we prepare to turn back the clocks this weekend, experts say the time change can have an effect on your mental health. And the best way to combat any possible negative impacts as we fall back an hour is to get ahead of them.
I think it's really important that people almost take inventory of their current mental health. How's your bandwidth? How have you been doing the past couple of months? It's so important to be proactive and really identify, am I feeling burnt out? We don't want to wait for the time change to happen for these symptoms to be exacerbated.
Amy Deacon is the founder of Toronto Wellness Counselling. She says there are two main reasons why the time change has consequences for our mental health.
Number one, we know from research that when we're not exposed to sunlight, we're more prone to experiencing anxiety and depression. The second factor is that in the winter months, our bodies actually produce more melatonin, which results in our feeling more tired, more lethargic, and our bodies produce less serotonin, which is our happy hormone. So all of these things kind of result in our feeling a little bit more tired, drained, and emotionally low.
Deacon says there are a number of ways to counteract the effects of the season and ensure your mental health remains in the pink. And the time to start is right now.
We want to get your sleep back on track. It's really important to be aiming for about 7 to 8 hours. Getting a good night of rest, it's not only good for our bodies, but it's also so good for our brains. We sometimes minimize the benefit of rest and it just eliminating the toxins that we carry.
Along with sufficient rest, Deacon says moving your body is essential.
It doesn't have to be going to the gym and grinding it out, but just going and getting fresh air, 20-30 minute walk every single day. When we're deliberate and consistent with our exercise, it releases endorphins, and those endorphins are so good for buffering our mental and emotional health.
She also points out that it's important to recognize the difference between what we call winter blues and something more serious that may require additional help.
The winter blues is perhaps we're having 1 or 2 days where we're not feeling our best, but when it comes to seasonal affective disorder, those are symptoms that are present for the better part of about 2 weeks. And so that's when people are really struggling. They're perhaps experiencing a loss of appetite, difficulty sleeping, difficulty getting out of bed, engaging in activities that used to bring them a lot of joy. And so when we see people in this situation, we're really encouraging that they connect with a healthcare professional, whether it's their doctor or a licensed therapist. I know that there's still a little bit of stigma, but connecting with somebody that can help navigate you through those seasons is life-saving.
For more tips on how to navigate the coming winter months and the mental health effects, you can go to our website, citynews.ca. For City News, I'm Dilshad Burman.